When you come in for your surgery, you're coming into our special outpatient surgery center. You're here about an hour, but the actual cataract surgery only takes about 10 minutes. We like to check on you before you leave and send you home with some coffee or juice and see you back the next day. One of the new things we can offer here at Mattax Neu Prater is what we call laser-assisted cataract surgery. And what that lets us do is it fine-tunes the strength and the power of the new lens we put in your eye.
When we take out the cataract and replace it with a new lens, we run some calculations to try to get your vision as close to 20/20 at distance as possible without glasses. There's several different types of lenses that are available. The standard one that most insurance pays for is called the monofocal lens, where it focuses at distance. There's also toric lenses, where some people have quite a bit of what's called astigmatism, meaning the front part of the eye, the cornea, is shaped in a different way and you need help with correcting that. There's also multifocal lenses. We try to set it for distance vision and also intermediate and up close vision. We try to reduce the dependence on glasses.
We have the best staff around. I'll put our crew up against anyone in town for their efficiency, their friendliness, and their ability to deliver compassionate care.